In the patient advocacy track, we had a session called Knowledge is Power, and the main thing about that was how do we actually, as a patient advocacy community, develop the knowledge and the skills to influence decision making in terms of health policy, in terms of oncological development, in terms of clinical development, and so on. So how can we be better advocates by building our knowledge and building our skills? Patients have a unique perspective on what patients really need, because quite often what the clinicians see is actually the clinical side of things. So they see the things that need to be treated and they see the things that require intervention, but quite often the whole context of living with cancer is a very different thing. And we as patients quite often have a very different perspective, because when patients return home from consultation at the doctor's office, they come home with a lot of questions, and their whole family actually not only asks about what is going to happen to me in my life, but also what is going to happen with me as a social person in my environment, with the quality of life, with my work, with all the questions connected to that. And we have a lot of understanding on patient preferences and patient priorities. And that's actually what we want to bring into the discussion. We don't try to be better scientists. We want to base our opinions on evidence that we get from the patient community and tell what the true patient preferences and patient priorities are, and bring that into the discussions when new trials are being discussed, when trial protocols are being defined, when data is being interpreted, and we think about what's the patient value of a drug or treatment or oncology care or whatever. And we have a lot to contribute on that discussion.